Bring in founder of Engraced Children, Biby Chikere, to talk more about this issue. It was big news earlier this year when the amended Disability Act was signed into law by Mr. President. Chief amongst the provision of this particular act is to rework public infrastructure in such a way that it will be convenient for people with special needs in the next 5 years. Just how much work do you think has begun in this regards?
So far, I don't think much has been done because for those of us who are parents of these children, it starts from, childhood, from infancy. We talk about people going to public places and all that, being able to access public buildings. Those are people who have even attained a certain level. But how do you manage a child living with special needs from age 2, for instance, to age 5? So I don't think all that has been put into consideration.
So it's one thing for government to implement this particular law and make policies available to achieve it. Help us understand what the role of the citizenry is from your experience in relating with children of this nature.
Okay, basically we do a lot of advocacy because even me, before I had my daughter, I didn't know anything about special needs. Occasionally, I will hear, okay, it's World Down Syndrome Day, and I'll see them like dancing on TV, but it didn't mean anything to me, and I didn't know that there was more to it than that. But you see, when I walk with my daughter on the streets, people look at me, they feel sorry, you see that look of pity and all that. They really don't know. They really don't know anything about this condition. So the first thing is educate people about it. Let people know what these conditions are, and let people know that these people are human beings and that they can actually succeed if given opportunity. Sometimes all they need is just a smile,
So as a parent who know exactly where the shoe pinches, you want to speak to government right now. What exactly would be your request?
I want the government to, first of all, set up diagnostic centers. Because in my work with parents, I found out that lots of parents don't even know what conditions their children are living with. And that's really dangerous because every special condition has its own management strategy, has a special management plan. So if you don't know what the condition is, how do you manage it? So from birth, these children should be, there should be a proper kind of assessment. So that's very important, and it's the responsibility of the government to put that in place. And beyond the diagnosis, there's the medical issue and there's the educational issue. These things go a long way in the development of the child. So special needs education in Nigeria should be affordable. Right now, it is private sector driven, and it's really, really on the high side. So it's a problem. And then when it comes to the health, it's also a problem. We still have lots of medical practitioners, I'm sorry to say, in Nigeria that don't even know what special needs mean, and they are medical practitioners. So they need to educate themselves, they need to know about this thing, and it has to be, the management should be affordable. For instance, a child living with cerebral palsy needs a lot of therapy, physiotherapy, occupational therapy. These things are expensive. Sometimes you spend up to 7,000 naira per session. It should be free like we have in other countries.
It's some good work you're doing with children with special needs, and we wish you all the best. Founder Engraced Children, Biby Chikere. Thank you for talking to us.